Hi, my name is Jim Watson. Thank you, Sarah. As she said, I manage our physical therapy clinic in Novi. We also have physical therapy clinics in Brighton and in Southfield as well. I'm here today to talk to you about what you need to know about patellofemoral syndrome and available treatment options. Before I get rolling with the presentation, I just wanted to go over a couple definitions just to make sure that we are all on the same page with some of the lingo. Medial means toward the middle of the body or like the inside of the knee. Lateral is more toward away from the middle of the body or the outside of the knee. Superior is toward the head or above the knee. Inferior is toward the feet or below. Anterior is in the front. Posterior is toward the back. Dislocation is when something actually goes completely out of place, whereas a subluxation is when it goes nearing to go out of place, but then goes back in where it's supposed to be. Just to review a little bit of the anatomy of what the knee is supposed to do. Looking at this first picture over here, the kneecap should fit perfectly in the little groove that's called the trochlear groove. And it's actually a bone that's embedded inside of two tendons. You have the quad tendon above the knee and the patellar tendon that's just below the knee. Normally, as the knee functions properly, it should be sliding inside that groove, just going straight up and straight down. The trouble happens when things start to go sideways and the kneecap starts to shift off to the outside. Now, we have these ligaments that wrap all around our kneecap, and they basically act almost like a puppet to where they hold the kneecap in place by connecting to all the different sides of the knee to make sure that the knee sits where it's supposed to sit. Now, some signs and symptoms of patellofemoral pain syndrome. Typically, there isn't a specific injury involved here, not like a fall or a car accident or anything like that. Usually what happens is when somebody starts a new activity and they get into it a little bit too quickly, or if they advance an activity that they're already doing just too fast. The pain is typically in the front of the knee or the anterior side or on the lateral side, but sometimes it can be medial as well, but typically I'm going to see it on the front and the outside. Typically the pain gets increased when you start a high level of activity, prolonged forces, or repetitive forces. So things like squatting, jumping, stairs, prolonged sitting, or running. Typically with patellofemoral pain syndrome, you'll get some grinding, popping, clicking, and I'll talk about those right now. So with the grinding, as the knee bends, there's more contact area of the patella onto the femur. So you can see in this area here, the patella starts to press into that femur. And then you combine that with the force of the muscle. As your quadriceps starts to engage, this tendon gets pulled and so does the tendon just below. So that just increases those forces as the patella starts to rub onto that femur. And just to give you an idea of how much force actually gets involved with that, while you're walking, there's about 50% of your body weight that compresses into the femur. When you're running, it's 3 to 4 times your body weight. And when you're getting up from a chair, it's almost 7 times your body weight, which is why this is something that's very difficult when you're having patellofemoral pain syndrome. Now, part of the trouble is when you start to get this grinding in here, you have this layer of cartilage that's on the femur that runs, it's this white in the picture here, and it runs all the way up here. And then there's more of that cartilage that's on the inside of the patella. And as you start to rub, that cartilage starts to wear thin and soften. And then as it continues to do that, then you start to get to where you start rubbing the bone on top of bone. So this is called chondromalacia patella, when that cartilage starts to soften. And then as it starts to get to the bone on bone, what happens is as you start to rub on the bone actually grows to protect itself. And then because it rubs more, it makes it grow more. Because it grows more, it makes it rub more. And that's why it's something that continuously gets worse and worse. And that's what starts leading to arthritis. As far as the popping and clicking, as the knee straightens out, there's less congruency or less contact space, which then creates some instability. Now, those ligaments that are supposed to hold the patella in place, now they're on a little bit more of a slack, and it allows that kneecap to shift a little bit more than what it should. When there's any kind of an instability, when something's either stretched out or there's a little bit of swelling that's introduced, those ligaments can kind of slide out of their groove. So if you kind of picture the ligaments wrap all around the knee, and each ligament fits in its groove kind of like this. And then what happens when there's some instability is it tends to shift out of the groove, and then when you move just right, it actually pops into place. So you really don't have to worry about the pop itself. That's actually a good thing. Nothing typically ever pops out of place unless there's some kind of a contact injury or something like that. It's only going to be popping into place. But the problem is it's a sign of instability. You don't want ligaments to be popping in and out of place. So that's what this presentation is all about, is teaching you how to get rid of swelling and continue to build up some strength and stability so it doesn't go out in the first place, and then it won't have to pop back into place. There's also a gas that's released, which is all part of what contributes to the noise that it makes. Now, the trouble is when you start to get that kneecap that shifts to the outside and you get that rubbing and the grinding, is that starts to increase more of the stress on the joint, and then that's when it creates the pain and the swelling. And then because that swelling happens, almost picture like that kneecap starts to float more than what it's supposed to because of the swelling that gets underneath of it. Because it floats, that's what creates that instability, and your body can always sense the instability before you'll ever be able to. It's part of our reflexes. And anytime your body can sense some of that instability, it makes everything just want to tense up to protect itself. And then because your body is tensing up so much, it just creates more compression into that patellofemoral joint, which then makes it rub more. And that's what creates a lot of the pain. And the trouble is that pain actually inhibits muscle. It's almost like when you're holding onto something and you kind of bump your arm, it makes you feel like you're going to drop what you're holding. That's basically what happens with your leg all the time when you're experiencing this pain. And then because that muscle gets inhibited, it's not holding that kneecap where it's supposed to, so it gives an uneven pull, and then it starts shifting that kneecap to the outside like we were talking about, and then it just continues to repeat itself. It hurts, so you tense up, and then because you tense up, you hurt. So a big part of what this presentation is about is to teach you how to get out of that cycle. Other related knee diagnoses, IT band syndrome is a really big one. Your IT band is this white piece that's running all along this outside of the knee here. And what happens is anytime that you start to get that pain and swelling or instability, anything going on in the knee, it triggers this to tense up to try to protect you. But because it protects you, there's actually a ligament that goes right from this side of the tendon right here, right onto the kneecap. So as it tightens up, that's what pulls the kneecap to the outside. So IT band syndrome and patellofemoral pain syndrome kind of go hand in hand, and they tend to affect each other and make each one of them worse. Chondromalacia patella, which we already talked about a little bit, is just as you start to rub on that patella into the femur, and it starts to wear thin. The trouble is when it starts to, when you start to have this patellofemoral pain, you want to try to take care of it as soon as you can, because chondromalacia is something that's a permanent issue. So when you start feeling the pain, if you can start working towards trying to correct it and build up some of the strength and stability, it should make it to where you don't lead on to the chondromalacia. Patellar tendonitis, the tendons in our body are all very tight, so that as soon as you pull on a muscle, it's what makes your body move. Because there's this constant pressure there, where's my cursor here? The patellar tendon is right down here. It's a very small space. So if the knee starts to swell, some of that swelling gets underneath that tendon and it creates inflammation there. And that's how you get the tendonitis. And then runner's knee is basically just a combination of all the things above. Another time that's very common to get patellofemoral pain syndrome is after surgeries. You can get it after a knee replacement, you can get it after a knee scope, or even another knee injury. And it happens because it's all this tension that we're talking about, and you kind of get into that cycle that I talked about, and that's what leads to a kneecap issue even after you had a knee joint surgery, you know, because the two joints are right next to each other. Now, a big part of what my job is in clinic is to figure out what's the underlying cause. You know, why are you getting this stress in the first place? So there's three main causes of this. You can have muscular issues, ligamentous issues, or bony issues. As far as muscular issues, the biggest issue is the hip. I typically see, even when somebody comes in with a very strong leg in general, a lot of times the hip is weak compared to the leg. It doesn't really matter how strong you are compared to somebody else, it's how strong you are compared to yourself. And when you have these muscle imbalances, that's what throws everything off. And our bodies are just like machines, and when you get that alignment thrown off, it's going to start wearing something out. And in this case, it's the patellofemoral joint. Typically, as far as weakness goes, it's usually the rotators, which when they get weak, it allows your your knee to rotate in, and it gets almost more kind of knock-kneed, how it shows in that picture on the lower left. And then any little bit that your knee starts coming to the inside, just natural physics is going to start pulling the kneecap to the outside, because if you picture it almost like a bow and arrow, the knee itself starts to come in and the ligament is on the outside. So that's part of what draws it out to be in a more comfortable position for the patella. And then that's what shifts it to the side of that valley that we talked about and starts to wear it thin. Another thing is the part of the quads. Your quadriceps are called your quads because there's 4 different heads. The one on the inside is called the vastus medialis oblique, and that's highlighted here on the picture on the right. And if you see how it connects over to the kneecap, it's off to this inside. So when you picture this muscle starting to contract, it's going to pull the kneecap to the inside, which then offsets whatever stress goes to the outside. So if this muscle is weak, it's not going to be able to offset these forces of possibly the IT band or any of the other forces that are pulling it to the outside. And that's what allows that kneecap to drift to the outside. Ligament issues. So we talked a little bit already about the IT band. This is the IT band right here. And if you picture it getting tight, it starts to draw this IT band out. And this is the ligament that attaches the IT band directly to the patella. So as it tightens up here, this ligament starts to pull the kneecap to the outside. And this is where that outside of the valley is, where it starts to rub and starts to grind and wear away at that cartilage that's behind the kneecap. The other issue can be a torn or a loose MPFL, which is your medial patellofemoral ligament. It happens a lot with subluxation or dislocation. So if the kneecap starts to drift off to the outside here and it starts to come up onto the ridge, even if it just goes up there and then subluxes, you'll typically stretch this ligament out, which is what helps to pull it to the inside. If the kneecap dislocates and it actually goes up to the ridge and then falls off the outside of the edge and it gets stuck out here, typically what happens is this ligament actually tears. And if the ligament's torn, there's nothing there to hold the kneecap to the inside. And then you start to get all these other issues that we were talking about that start to pull that kneecap to the outside and nothing to counteract those forces. A lot of times if you tear the MPFL, it requires a surgery. Another issue is bony issues. If you look at the patella here, if it gets too big, it won't fit into the joint perfectly, and you're going to get some rubbing somewhere. Another issue is the shape. As you can see here, it fits perfectly in the shape of the kneecap, matches perfectly with the shape of the groove. The trouble is if the bone was just developed improperly, or because of stress or an old fracture or a surgery or anything like that, that shape of the kneecap can change, and then it puts stress over onto that groove. Excuse me. Another issue can be the location of that kneecap. So the kneecap can be shifted a little bit to one side or to the other, which is going to cause a grinding over to wherever it's pulling. It can also sit a little bit too high or a little bit too low. And ultimately, anytime that the kneecap isn't sitting perfectly exactly where it's supposed to, it's going to create a stress and a grinding somewhere. Now, as far as the groove is concerned, some people are just born with a groove that's a little bit more shallow. And if it's shallow, that's what allows that kneecap to move a little bit more in places that it's not supposed to go. And then the body tends to tense up like we talked about, and that's what really pulls that kneecap to the outside. Another issue is if this outside edge here, the outside is supposed to be a little bit higher than the inside. If the outside's a little bit lower or it's a little bit smaller, it's going to allow this kneecap to just drift off to the outside. And then that's what starts all these problems with the grinding on the outside. Another bony issue is we're all born with something called a Q angle. And what that is it's just an angle from the measurement from the hip down to the knee and down to the ankle. And the trouble is when that starts getting a little bit too much, then it starts to draw that kneecap to the inside, or I'm sorry, it starts to draw the knee to the inside, which then draws the kneecap to the outside. Typically in males, it's 10 to 15 degrees. In females, it's 15 to 20 degrees. Anytime it gets outside of that range, you're going to end up getting to where those knees start coming together, and that's what starts pulling on that kneecap. And the trouble is there's always a chain reaction effect as well. So as the knee starts to shift to the inside, you start getting a rotation of the leg, and then you start getting the foot that starts to pronate in, which basically is what causes flat feet. And then the trouble is now you have all this stress from the top that's pulling down onto the knee, and now you have the stress on the bottom that's pulling up on the knee as well. So when you get the stress above and below, it's almost like when you have a pencil, and if you were to try to bend that pencil, it doesn't break where my fingers are, it breaks in the middle. And that's a lot of times when you're having a knee issue, it's not because of necessarily what's going on at the knee, it's because of what's putting stress on the knee. And a lot of times it's coming from above or below. Now, as far as treatment of patellofemoral pain syndrome, the first phase is getting into the initial program, which involves exercise, muscle spasm release, stretching, and taping techniques. Then once you start to feel less pain, start getting more strength back, normal everyday things like stairs get a little bit easier, then you want to shift into phase 2, where you really want to start building some of the strength and stability. Once you start feeling like you're getting stronger and things are getting easier, then you can get into the returning to sport if that's something that you're looking to get into. Now, phase 1, the initial exercise program, the biggest thing is you just want to get moving and loose. If you do too much too fast, it's just going to create more pain, more swelling and grinding, inflammation, and it's just going to get you involved in that cycle that I was talking about earlier, which we really are striving to try to get out of. That's really the whole point of all this, this program. Quad strength is the primary stabilizer of your knee. Your research shows this time and time again. Anytime you have some weakness in the quads, because it's the primary stabilizer, it's going to end up allowing that kneecap to shift in ways that it's not supposed to. And it also can allow the knee itself to start shifting front to back or rotating. And it's those accessory motions that start getting the body to want to protect itself. And that's what's going to make it start tense up. And that's what's going to create more of that compression and that pain. Again, your hip is what controls where your leg's at in space. So if the hip has any kind of a weakness anywhere, it's going to end up putting your knee in a bad position, and that's what's going to put extra stress on it, typically causing that kneecap to shift to the outside. One of the big things that I always talk with patients about right away is just get gentle motion. Basically, as you're moving your leg back and forth in a pain-free motion, it's going to create a pump and help to flush some of that swelling out of the knee. And it's a way that you can start to reverse that cycle because you have less swelling and less instability. Then your body doesn't feel like it needs to protect itself so much. Then you can start to build more strength, and it just continues on the right direction instead of going the wrong way where it starts to tense up more and hurt more. It's also something that in advice that I give to patients when they call. Like sometimes I'll get a call 6 months after they've left therapy, after they were feeling great, and say, hey, things are starting to come back a little bit. I always go right back into just the basics of just get it moving and loose, get this gentle motion, and then ice. I always get the question about heat versus ice and where they play a role. In general, heat is going to loosen up all the muscle around the joint, which then takes the pressure off of the joint. That's why heat feels so good. The problem is heat's also going to create swelling, which then is going to make the problem last longer and potentially get worse. So that's where ice comes in. Ice doesn't do a very good job of getting rid of swelling and more helps to prevent it. So what I typically have people do is to go through all these exercises to try to help flush the swelling out and then put the ice on to stop it from coming back. The best way to think about ice is so you don't pay for something later. So whether it's doing the exercises that I give you or any other type of exercise, or if you're doing any yard work or housework or anything that's a little bit more active, if you put a quick 10 minutes worth of ice on afterwards, a lot of times you won't pay for it later on that night or the next day. One way that you can hedge your bet a little bit as far as the heat versus ice, if you're ever having just a really bad day, whether it's because you did a little too much one day or for whatever other reason, you can heat it first just to loosen it up and take some of that pain away. But then you want to make sure you do the exercises right away to help flush out that swelling you just created. And then you put the ice on to stop that swelling from coming back. So in general, it's a great rule of thumb. If you're ever having some pain in the knee and you want to try to stay away from narcotics or any other kind of medication, heat it, then move it, then ice it. It's almost like an exercise. We think about how you warm up, you exercise, and then you cool down. It's the same idea. When you heat it, move it, ice it, it gets you moving better, but without having the consequences later. Now, the exercise that I like to start off with people, I always want to make sure that they want to get a good warm up first. So if you have a bike available, stepper bike, elliptical, anything like that, just to kind of get the joint moving. Typically, you don't want to exercise a cold joint because you have all this swelling that kind of settles in the cracks. Swelling is typically what causes most of the pain, the lack of motion, and the lack of strength. And what happens when you've been sitting for any kind of a time period is all the swelling that's in the knee just kind of settles in the cracks. And that's what gets you sore, stiff, achy, hard to get comfortable. That's what ends up causing a lot of trouble. So when you get a good warm up, it starts flushing a lot of that fluid out, and you're going to get a lot more out of your exercises. They'll be more efficient, and they'll be safer as well. So one of the first things that I always like to get people started on is the 4-way straight leg raise. So we have kicking straight up, kicking out to the side, kicking backwards, and then kicking to the inside. And ultimately what we're looking to do here is build a corset of muscle all around your hip so that you can keep your knees straight up and down, because the way that our body should work is you should have pretty much a straight line from your hip to your knee to your ankle. Anytime you start veering away from that, that's what's going to put extra stress. I also like to give something called short arc quads. This is this exercise in the upper left corner here. It's a good way to start building some of the quad strength. And it's also a good way to create this pump that I was talking about. As you're going up and down with the foot here, it's going to help to flush a lot of that swelling out of the knee and help you feel better. This is another one that you can also do at night. It's a typical time when people start getting more pain. Throughout the day, you're starting to move around and you're creating some swelling, but you don't notice it as much because you're moving around. So you're starting to flush some of the swelling in and out of the joint and making it to where it doesn't settle. The only trouble is then when you start to relax at night, all that swelling starts to settle in the cracks like I talked about. And at the time that you want to feel the most comfortable and be able to fall asleep, that's the time that it gets the most painful. So if you do an exercise like this right before you go to sleep, a lot of times it'll flush that swelling out and you'll fall asleep a whole lot easier and stay asleep longer. And if you ever get woken up by the pain, again, it's typically because that swelling was settling. If you just try to lay there, you're just going to get more stiff. If you get up and move around, it'll help to loosen you up, but you're also creating some swelling that might get you up again in a couple hours. But if you do something like this short arc quad here, where you just put a pillow underneath the knee and get that leg moving a little bit, a lot of times it's going to get you to fall asleep faster, and you'll be able to sleep longer too, and hopefully get you through the night. Another exercise is bridges. That'll start to get the glutes kicking in as well, and the quads, and it also starts to get them to work together. Just pure strength is something that's obviously very important. You need a foundation of strength in order to be able to do the things you want to be able to do, but it's also important to get the coordination. You need the hip, the knee, and the ankle to all work together, and that's what a lot of these exercises are trying to strive for. Doing heel raises, going up and down on your toes. Your calf, even though we think about it as down here, actually attaches above your knee. So as you go up and down on your toes, you're taking this muscle and contracting and relaxing, and it actually helps to pump some of that fluid out of the knee. And it's also a good one if you've been sitting for a little while and you get kind of stiff and achy. It almost kind of primes the pump a little bit. If you do those first couple steps are a little bit stiff and you feel like it's almost have a limp. If you do a couple of these heel raises, a lot of times it'll loosen up and allow you to be able to walk around without the pain. And then balancing on one foot. You want to make sure that you can do this after the pain goes away. If you stand on one foot and it creates some of the pain, it means you're not ready for it yet. Most of your balance comes from your hip strengthening, which, as we talked about before, that's one of the primary issues with getting this knee pain is because of weakness in the hip. So the nice part is as you work on this balance, it's going to help to create some strength in the hip. And then as you continue to build more strength in the hip, it's also going to improve your balance, which not only is that good just for the balance by itself, but it also makes you more efficient when you walk because you don't have, your body doesn't have to constantly try to stabilize you and balance you. So typically you can walk a lot farther before you start getting some of that pain and irritation and then just get some more endurance in general. The one thing to consider, especially in this initial phase, is you want to really try to avoid any strengthening past 90 degrees. As you get more and more of a bend in the knee, you get more of that compression, as we talked about earlier. And if you start introducing like squatting and things like that past 90 degrees, it's just going to really start to irritate and start to bring a lot of that inflammation back and get you back into that vicious cycle we talked about. Manual techniques where you're actually doing some hands-on things on your own. One of the biggest issues identifying is muscle spasms. Your muscles don't spasm for no reason. It happens because your body's trying to protect itself. Anytime your body can sense that instability, it's just going to start tensing things up to protect, but then that's what's going to end up creating more pain and more compression in the joint. So I always like to start with that to try to loosen up as much as possible. You can use a foam roller or a rolling pin or something like that to roll up and down the leg to find these knots. They almost kind of feel like speed bumps. As you go up and down the leg, you'll kind of feel where it kind of rolls up and then off of it. And the reason for that is muscle kind of looks like this, and it contracts and relaxes. When your body's protecting itself, basically it's stuck in a contraction, so it almost kind of sits like this. So when you feel those speed bumps, it's kind of like you're rolling up onto it and then off of it. So what you're really looking for is you want direct pressure right onto that speed bump for about 10 to 15 seconds, and that's what's going to get it to release. This is the whole basis behind deep tissue massage or trigger point release. Stretching alone will not help the tightness. The trouble when you have something like this is because your body doesn't want to be loose, it wants to be tight to protect itself. If all you're doing is stretching, all you're doing is making your body want to protect itself more. But when you do the muscle releases, that's going to help to actually inhibit the nerve that's triggering your muscle to want to tense up. And then you use the stretching to help to reinforce that muscle release that you just performed. And then as you continue to build more and more strength and stability, then those spasms are going to come back less and less. Now, for the larger areas like the quad and the IT band and the hamstring, you want to use something that's larger, like the foam roller, a rolling pin. A runner stick is a lot like a rolling pin. If you haven't seen those before, they have them at any runner store. Or massage guns are starting to get a lot more popular these days. Some of the smaller areas like the glutes and the piriformis, which the piriformis is just a muscle that's right in your hip. It's kind of underneath some of those glute muscles. And it goes hand in hand with the IT band. Typically when the IT band wants to tense up, piriformis goes with it, and then you get that outside of the thigh and the hip that's starting to tense up. And that's what generates a lot of that pain. So for here, you want to use more like a tennis ball or a massage gun. And I'll show you a couple pictures of these. As far as the foam roller, when you're trying to get the quads, you just lay right on it like this. If this isn't enough pressure on the quads, you can always take one leg and shift it over on top of the other leg so that you have your whole body weight just on that one quad. And then what I like to do is just kind of roll up and down to kind of find those speed bumps, so to speak. And then wherever you find, wherever it either hurts more than the other places, or you feel like you're rolling up onto those bumps, that's where you hold it for that 10 to 15 seconds. Now this one in the middle here, she's working that IT band. Same idea, you roll back and forth to find those spots. And then you hold it for that 15 seconds, 10 to 15 to loosen it up. Now the big thing with the IT band, it's actually only just a muscle on the very top, right close to the hip, and then the rest of it is all just tendon, so it doesn't contract and relax like the muscle that I just talked about. So you can't really stretch an IT band like you would think with other muscles. Really what you're doing when you're doing an IT band stretch is you're stretching this muscle that's on the top of the hip. We'll get a little bit more into that in a minute. And then the other one here is the hamstring foam roller. Again, you can lift up the one leg on top of the other so that your whole body weight's on that hamstring to get a little bit more pressure onto those knots. And then using a tennis ball, you can use a lacrosse ball to get onto those glutes. You can just sit regularly without the leg crossed like this. And a lot of times at first, that's what you're going to want to do. But once it feels like you aren't getting quite the stretch with the ball, that's when you cross a figure four, like the picture shown here at the bottom. And it's going to bring all the muscles to the surface, and that's going to help you release the muscle better. Now, as far as the stretching is concerned, this one here is a quadricep stretch. This one here is a piriformis and glute stretch. This is a hamstring stretch. Notice how his back is perfectly straight here. Typically when I give people hamstring stretches, everybody wants to lunge forward. And the big thing to realize with any kind of a stretch is it's not the goal to try to touch your toes or any other kind of landmark. The goal is to stretch the hamstring. So when you put your back flat like he has here, it's going to put the pelvis in the right position so that you're actually stretching the hamstring from the top up. And then as you lean forward, you're also stretching it from the bottom down, or I'm sorry, from the bottom. So it's going to be a more efficient stretch, and it's also going to keep you safer in your back. Now, the big thing with any of these stretches are you want to hold it for at least 30 seconds. With any kind of a stretch, it's all about how long you hold it, not how hard you're pulling. If you're ever doing any of these stretches and you either hurt or you feel like you can't make it to 30 seconds, it means you're pulling too hard. Our bodies are kind of like rubber bands, or at least the muscles are like rubber bands in our bodies. You know, if you picture, if you stretch a rubber band and let right go, it's going to go right back to the way it was. Whereas if you stretch it out and hold it out there, it's going to stay stretched out. And that's kind of what we're looking for with our bodies. And that's why I'm a whole lot more concerned with how long you're holding it rather than how hard you're pulling in. This one here is a calf stretch. And then this is that IT band stretch that I was talking about before. It's the back leg that goes back behind is the IT band that you're stretching. And what you want to do is try to pull that hip to the outside and have the shoulders going to the inside. But you can even do this against a wall to give you something to kind of brace off of a little bit. And again, it's not the actual IT band that you're stretching with this, it's more this TFL, which is tensor fascia lata. But you can still get a little bit of a stretch there. But again, that's why I like the foam rolling better than the stretch for all of these, but especially for the IT band. Now, taping techniques, I'm a big fan of the taping. In clinical practice, it helps me decide whether it is actually patellofemoral pain syndrome or if there's something else going on. So I can use it a lot as a test, as treatment. The big thing with the tape is it's going to decrease the stresses in the joint because it's going to put the kneecap sitting where it's supposed to, as opposed to the side of the valley causing that grinding and the stress. And then if you picture, so you have this valley here with the kneecap sitting in the middle it's supposed to be, and with the patellofemoral pain syndrome, it starts to shift to the outside. And then it starts to grind, and that's what caused the trouble. What the tape's going to do is shift that kneecap to the middle of the valley and then lock it in place to where it can't get to the outside. And that's going to give you a little bit of room to breathe here so that all those structures here and then under here can start to calm down and get some of that inflammation away and let them start to heal. The nice part about the taping is you typically get an instant reaction. You know, as soon as people get off the table, they start to feel better and move a little bit better. So it allows me to start doing more strengthening with them because they can do it pain-free. It allows them to return to function to where you can start doing step over step, let's say, or be able to walk without having that pain. And sometimes you can get people to return to sport quicker with the tape as well. Everybody's a little bit different as far as what their issue is, how their bodies were made. So sometimes you have to adjust the tape a little bit to match the person. So you might have to, excuse me, adjust a couple times, where one way you'll try it with one angle, and then the next time try it with a different angle, and you do whatever's going to work best for you that gets you the best results with the least amount of pain. Typically, I like to do some mobilization of that kneecap first. And basically, you just want to kind of get it moving, get some flexibility back in that kneecap so that when you push it over and then lock it down with the tape, you're going to have a better effect because you'll be able to push that kneecap where you want it to go. So essentially, that patellar mobilization is going to prepare you for the tape. So you always want to stretch it out a little bit first, like it's shown in the two pictures below, in order to prepare you for that taping. Now, there's two kinds of taping that I want to talk about today. The first one is McConnell taping. It's a little bit more aggressive. It has a compressive component, and it's basically because you're putting the kneecap into that middle of the valley and then you're locking it down into place. I do like this technique quite a bit because it kind of forces that kneecap to stay where it's supposed to stay and doesn't allow it to go to that outside edge where it gets that grinding. But because it has that compression force, sometimes you end up having to where it feels good essentially or initially, and then you start to get a little bit of pain from that. Now, the way you do it, there's a white piece of tape underneath the brown tape here that goes, you can see the white all around the edges here. There's no pull on that. You just put it down directly on the skin, and it's basically there to act to protect the skin and also act as an anchor for the brown tape. And then you want to take the brown tape and you put it over top of this outside edge of the kneecap. Down here, you want to hold the skin in place so it almost kind of makes these ripples down here. And then you want to push that kneecap toward the inside. And then you're also pulling with this hand, and you're using the tape to pull that kneecap to the inside at the same time you're pushing it from this side, and then you lock that tape down. And then it's really important to make sure that you rub all over that tape to activate the glue. Basically, it's the friction from your hand that loosens up or warms up the glue, and it's going to make it to where it sticks better and it's going to last longer. Typically for McConnell taping, it'll last about 3 days. You generally don't want to go any more than that because it's going to start to get you a little bit of a rash and you can get some skin breakdown. And if it's something that's really helping you, you want to get it for those couple of days, then give yourself like a night to let air get to it, let the knee breathe a little bit, and then you can get back to it that following day. The other kind of taping is called kinesiotaping. This is one that you see quite a bit in athletes these days. It's usually black, sometimes it can be brown. You see it all over shoulders and knees. It's a lot less aggressive than the McConnell taping. I'll show you a picture of it in a minute, but it has some elastic qualities to where when you stretch it this way, it'll stretch, but when you go the opposite way, there is no stretch to it. And it just helps us to either facilitate something that we want to make happen, or it helps us to inhibit something that we want to stop happening. There's a lot less compression to it. It's a lot less aggressive, and basically it just kind of guides the kneecap in place, whereas the McConnell more actually puts you in place and locks you in. So for the kinesiotaping, you want to cut a piece that's about 10 inches long, and you want to round the corners off with this tape. Because it actually has a stretchy component to it, almost like an ace wrap, it can want to come up a little bit, and also having pants rub over top of it, having the rounded corners just kind of helps it to where it doesn't peel up. You want to start out by having the legs straight. And then as this picture shows, you want to stretch it out to 100% max that it can stretch. And then you put it right on the knee, and you want to rub that area to make sure that it stays there very well. You put it toward the outside of the kneecap, and you only use just the inside, or I'm sorry, just the middle of that tape. And then you want to bend the knee all the way back as far as you can. And then you're going to put the tape down the bottom of the knee and the top of the knee, and that's not going to have any stretch at all. So the idea there, if you see the final product here, is this area is going to be stretched to the max, so it doesn't have any more stretchiness to it. So it almost acts like a pouch in a slingshot. And then all the area up here and down here hasn't been stretched at all, so it still has its full stretching capabilities, and that acts as the band of the slingshot. So ultimately, that's how it guides that kneecap over to the inside of the joint and stops it from going to the outside. And again, you want to just go over top and just rub it as best you can just to activate that glue. All right, so phase 2, the important thing is you want to make sure that you're getting through phase 1 without having any pain. If you still have some pain, you just need to stick with that first phase for longer. You might need to figure out whatever is still causing the pain and avoid those parts and just focus more on the things that are not causing the pain. Phase 2 is to build the strength and stability. You can progress any of the exercises onto single leg where it's appropriate. You want to start adding more functional exercises. This is where you can start doing stair training just for exercise. which, to be honest, there's nothing that's ever really been proven to strengthen better than just plain old stairs. Every year we get new gurus and new exercise equipment, but good old-fashioned stairs are the best way to get strength back in your knees, as long as it's not hurting while you're doing it. You can also focus on some of the lateral and the rotational components too. It's pretty easy to start getting strong just going forward, but it's when you're going side to side or the rotational that takes a while to start building the strength there. And that's really what protects you against having that kneecap shifting in places that you don't want it to go. You can also add in some jumping, cutting, pivoting, plyometrics. The biggest thing anytime that you're moving on to this second phase is you got to make sure that you're using the proper techniques and that you have the proper body positioning. If you start to lose some of the technique, you're going to end up creating the stress on the joint, which is the whole point of what you're trying to avoid in the first place. Some of the non-weight bearing exercises that I like in this phase are fire hydrants and donkey kicks. So in the fire hydrant, you go on all fours and you're just kicking this knee straight up. Or you can even shift a little bit forward and go up and down from this position. The biggest thing you don't want to do is let the knee come back and go up and down back here. You're going to use some different muscles for that. And you're not going to be activating those rotators that we're looking for to help keep that knee to the outside where it's supposed to be, or keep it to line up with the hip. And then donkey kicks are where you're just kicking straight up to the ceiling and then back. Now, if you did have any kind of a surgery where you can't put any of the weight on that knee, you can always just do it where you're putting the knee on that other leg and just kicking with the painful side. And if you have surgeries or injuries to both sides, you can do either one of these exercises kind of leaning onto the bed or the kitchen counter, where you're kind of just bent forward, and then you do the leg movements as you're leaning forward with the weight on the hands on that countertop or wherever you're leaning onto. Comerford progression is basically a way to get all the different parts of the hip kicking in and getting them to activate. The first one is called a clamshell, where you start with just your knees together and then you just raise this top knee like it's showing right here. And then you have the reverse clamshell, where you actually have the knees stuck together and you lift your foot back and forth. And then you have a raised clamshell, where you start out with the knee up high, and then you're going to take the foot and actually go down toward the other foot and back to neutral and down and back up. And then you have a raised reverse clam, which is where you start with that knee up high, and then you're going to lift that foot up and down from that position. Now, some of the weight bearing exercises that I really like are lateral and forward side stepping. This one here is the lateral step. So you have a rubber band around the ankles. You can also use it with ankle weights with this as well. And you take side steps sideways or to one direction, and then you go back facing the same direction, going to the other way. You don't want to turn your body, because you want to be pushing off with one leg going one direction and then push off with the other leg going the other direction. Otherwise, it's just one leg that's getting all the work, and you want to work both sides. The forward side stepping is you start in this position, you're going to take a step out to the side, and then you're going to meet it with this way, and then step over to the side here, and then back and forth. So it's almost like a skating motion. Then the other exercise that you can do with that rubber band or the ankle weights is the three-way kicks. So you want to kick forward, kick backwards, and kick sideways. Now the leg that you're kicking with is going to build more power, and the leg you're standing on is going to build more stability. And it's important to build both the power and the stability for the side that's injured. That's why you want to make sure that you're doing both legs on this. You know, the same thing with the side stepping. There's good old-fashioned squats. You know, they've been around forever, and there's a reason for that. You want to make sure that your knees don't go in front of your toes. That's going to put extra strain and get you past the 90 degrees before you're ready for it, or before you realize that you're there. And if you can keep your weight on the heels, it's going to help to make sure that your knees don't go in front of your toes. You can start by going at 45 degrees. That's what keeps some of that pressure off of that patella, and then progress towards 90 as long as the 45 degree doesn't feel too bad. Then you can either progress to a single leg, or you can actually add a resistance band around your knees, keep them a little bit separate so you're constantly working those hips, and then do the squat with that rubber band around the knee. Lunges is another exercise that I like quite a bit. I like to do alternating lunges as opposed to just doing one at a time and then the other. It just adds a little bit more of a balance component, which again all comes from the hip, and the more you can stabilize or strengthen that hip, the more it's going to stabilize the knee. So we start out with just the forward lunges here, where you're going forward and then back up to neutral, and then you step down with the other leg and just reverse back and forth. This one is when you're going to take the step backwards, which is a reverse lunge. So you'll take the step backwards and down and then back up. And again, you can alternate this back and forth. Doing lateral lunges, just going out to one side, and then you can go over to the other side. And then rotational lunges, where you start out with your toes facing one wall, and then you rotate so that your toes face to the other wall, and that's what's going to get you your hips to rotate. Squat rotations are a way where you put the rubber band around your thighs, or you can go around your knee as well. You maintain this kind of semi-squatted position, and then you're going to rotate, where you take a step outside and then rotate and then rotate and rotate and then rotate till you get back to this same area. You know, I'll usually have people do about 5 rotations one direction and then 5 rotations the other direction. And the more you work on the knee to kind of pull to the outside, the less you're going to get of that knock knee, which is what really creates that kneecap to want to shift to the outside. Rotational or VMO step-ups is going to help kick in that muscle that's on the inside of the knee that we talked about. And you start with your feet on the ground here, and then you put your foot up onto the step facing that perpendicular wall, and then you're going to step up onto it, rotating 90 degrees, and then step back down facing that same direction again. So you'll rotate as you go forward and then rotate back as you come down. And then mountain climbers are you start out in a push-up position, which is really going to start kicking in all the muscles. It's a great full body workout. It's going to work the arms, the shoulders, the core, the hips, and all down the legs. And then as you start to shift the knees in and out, it's really going to get a lot of rotation in the hips and start to really build a lot of that strength and stability. Then phase 3 is the return to sport, if this is something that you're looking into. And if it's something that you're not necessarily looking to return to sport, it still can apply to walking tolerance, regular exercise tolerance, or whatever you want to get into once your knee starts feeling good. The biggest thing is you don't want to fight through pain. Anytime that you fight through pain and you just keep working through it, just thinking that you're going to continue to get better, the problem is it's just going to create more swelling for sure, which then it creates more inhibition. So as you think you're trying to push through something to build more strength, all you're doing is turning the muscle off and inhibiting it. So you're not going to build the strength like you think you are, and it hurts, you know. So you really want to try to avoid that. And you might actually be causing damage, you know, like with chondromalacia patella. If you fight through pain, you're just going to continue to wear that cartilage thin and start to get to more arthritis and cause more of an issue and definitely more long-term effects. Now, the thing that I like to start out with is interval running or interval walking. With the interval, what I'm looking for is like a 1-to-1 ratio in the beginning, where you run for a minute, walk for a minute, run for a minute, walk for a minute. And then as you start to get better and better at that, then you start to just increase those ratios, where you start to you start to run for 2 or 3 minutes and just walk for 1. And then you can start to continue to increase the ratio, or you can start to increase the amount of reps that you do with the distance. But you just always want to make sure that you're getting that back and forth. It just helps the knee from swelling. You also want to make sure that you continue to cross-train on the days that you're not getting out to walk or getting out to run. Running alone will not keep the muscles strong enough to keep the pain away. And that's something I can't emphasize enough. In fact, I get a lot of people in my clinic that had that as their thought process, and they just stopped doing all the workouts. And whether it's because they didn't have the time or life just gets in the way, the trouble is, all you do is you have these imbalances of the muscle, which creates more stress on the joint. So all you do is you keep running more, which then creates more stress. You're actually causing more harm than good. You know, so as long as you're continuing to do the exercises that we just talked about in that second phase, and continue to actually strength train along with whatever kind of cardiovascular that you're doing, it's going to make sure that not only is it going to be more effective and more efficient for you, but it's going to keep you safe and healthy as well. And then it's always good to increase or incorporate some of the other exercises as well, like biking, swimming, rowing, any of the things like that, elliptical. You know, you don't want to just have your body doing the same exercises over and over again, because then the same muscles get strong and the same ones get left behind and become weak. You know, one of the biggest issues here is it doesn't matter how strong you are compared to somebody else, it's how strong you are compared to yourself. And anytime you get those muscle imbalances, that's when you're going to start getting things shifting in places that they're not supposed to go. All right, now we have the soreness rules. If you start getting into a little more of the high-level exercises, whether it's running or jumping or cutting or anything like that, if you don't have any pain during the exercise and you don't have anything afterwards, you know you can increase next time one of the exercise variables, which we'll talk about in just a minute here. If you have a little bit of soreness that night or a little bit the next morning and it goes away by lunchtime, that's telling you that that's your limit. You don't really want to increase it until that goes away. And when that does happen, you want to make sure you get a little bit of ice on as soon as you get finished with that exercise, and then maybe do it again later on that night, so that hopefully you can try to minimize what you're going to have the next day and continue to be able to build on the program and continue on that program. If the soreness continues the whole next day, then you know you did too much. You definitely need to get the ice on, and you need to back off on one of the variables. Now, those variables can include time, repetitions, distance, speed, resistance, or weight. There's always ways that you can change things, and modify them to what you want to be able to do. If you have these soreness rules, then you have to modify one way or the other. But you can also modify them even if you're feeling good. If one day you want to start going faster speed, but you don't do less distance, and then other days you work on more endurance and you'll back off on the speed and go longer time. These are all just ways that you can change things up just to make sure that you're getting everything out of the exercise you're hoping to get. And first, I want to thank everybody for joining us, and that concludes my presentation, and we'll open it up to questions now. It's a great question. So any of the exercise to avoid are typically anything past 90 degrees, but ultimately it's anything that hurts. If something hurts, that's when you're definitely creating swelling, and you might be causing damage that can lead to some more permanent damage as well. So you want to make sure that you're working out pain-free. So those are probably my two biggest answers for that: is nothing past 90 degrees and nothing that causes any pain. If something does cause pain, it means you're either going too far, too fast, too many, you're doing something. Take one of those exercise variables and back it off. As far as the rest is concerned, it's very important to get the rest. So I typically have people, when they finish with the program with me, I usually have them switch to a 3 days per week. And that way, at that point, they're starting to work on some high level exercises. So I don't want them to do too much too fast. So then they can get that day of rest in between. The one thing that you have to think about with the rest, though, is with the swelling. So there's kind of different ways to look at the rest. As far as doing, don't do any high level exercises multiple times a the day or every day. You want to make sure you give yourself that rest. But the one thing to watch out for is if you go from exercise to just going sitting on the couch, that's when you just created all this swelling while you're doing this exercise. And then when you sit down, all that swelling settles. And then that ends up getting you more sore, stiff, achy, hard to get comfortable. So your best bet is whenever you're going to get the actual rest itself, you want to do the ice as soon as you finish with the exercise, and then do something to kind of get moving and loose. The one exercise that I showed you, the short arc quads earlier, where you can put a pillow underneath your knee, and you just you extend the knee and then let it flex, and extend and flex. That helps to create a pump to flush it out. But one thing you can do that really helps a lot as well is take something that rolls. So a bottle laying on its side or a ball, and you can put it underneath your foot, and then you just roll back and forth on your foot. And then that also creates a pump in your knee and helps it bend back and forth. That's great for watching television, eating dinner, if you're on a long car ride. If you do something to kind of get it moving while you're resting, when your weight is not on it, that's what's going to flush any of that swelling out and make sure that it doesn't become an issue for you.